Hi, everyone. My name is Jim McFarland. I'm a licensed clinical social worker and clinical counselor. I am a clinical therapist whose specialty is anxiety, and I'm certified in that. I've been licensed for over 20 years now, and I'm licensed in the state of Georgia and in the state of Florida. And so I want to give you some real answers to real anxiety questions that you may have. So one of the questions is that often comes up is why doesn't talk therapy work for anxiety? Why doesn't talk therapy work? And I'll just be very honest, it doesn't. Okay, so let's just get that out of the way first, right? So I'm fond of saying that things are excremento de toro. They're bullshit. And one of the things that's bullshit about how people treat anxiety and how professionals are out there trying to treat anxiety is that talk therapy is somehow going to make anxiety go away. Certainly, if you have anxiety that's on the lower end of the scale, and I always use this, what's called a Likert scale, it's 0 to 100, it's a fancy word, or SUDS, subjective units of distress. 0 would be I'm totally relaxed, totally at ease, maybe even almost asleep. 50 would be, wow, I'm really uncomfortable here. I'm handling it, but man, it's just super uncomfortable in here. I've got a lot of physical sensations, a lot of worries and thoughts. And then 100 is I'm panicked. I'm going out of my skin here. So if you have anxiety that's, I would say about a 30 or below, so you feel some discomfort. It's not every day. It's not like you're drowning in it every day. Maybe it could be situational. Maybe you have some stressors and so forth. If you have anxiety like that, then talk therapy might be able to help you. And I think this is really what leads most therapists to advertise that they work with anxiety. Now I'm going to give you the honest truth about that. It is true. If you look at anxiety in that form, 30, a SUDS 30 or below, mild anxiety, I've got some mild worries, I'm losing a little bit of sleep, I've got some stress in my life, I've got some things at work that are worrying me, or some things in my relationship that are worrying me. Yes, then talk therapy, and then that would be true, what most therapists are saying in their advertisements and in their Psychology Today, so forth. What they're saying is true. They can work with that and they can help you out with that. What they'll usually do is they'll talk about the issues. They'll help you to problem solve. They'll help you to come up with your best way. They'll also, it's just good to have somebody that can just listen to you and just hear you and hold space for you. They may use some methods, such as maybe they might use some what's called mild cognitive behavioral therapy, maybe to get you to look at your situation in a different way, maybe temporary coping skills to be able to work with it, maybe problem solving or stress solving skills, being able to have an action plan to take care of certain stressors in your life and so forth. That would be what the general run-of-the-mill therapist is going to do, and any therapist worth their salt should be able to do this. But now when you talk about real anxiety, hardcore, hard-hitting anxiety disorders, what most of the therapists out there are saying, yes, I work with anxiety. No, you don't. This is a very specialized field, and they are full of bullshit if they are telling you that they can help you with those disorders. The anxiety disorders are really in a class all by themselves. They're a lot different than mild anxiety that somebody might experience, maybe from a life transition or something changing in their life, or maybe losing a job or breaking up with someone, or those are certainly, and they can even have episodes that are intense in there a little bit, but they're not the type of anxiety that comes with a full diagnosed anxiety disorder. And in those disorders, people feel like they're drowning with anxiety. They may feel incredible body symptoms that are hard even moment to moment to cope with. They may feel incredible different thoughts and incredibly difficult thoughts that are going through their mind, either unwanted thoughts or constant worries or constant fear. Usually it's a fear of either dying, going crazy, losing control, and usually that's a constant fear. Maybe it waxes and wanes a little bit during the day, but it's in general, it's pretty steady. So we could look at anxiety, anything above a 50, maybe even a 45. 45 or above, and you've had that consecutively for maybe longer than 3 weeks, then you may want to go to or get to an anxiety specialist. Those are the folks that are really going to help you to dig in. Let's say your sleep's disturbed and you can't function at work, and you're having trouble functioning at home, and you're afraid that all of your responsibilities and so forth are going to cave in and implode on you. this is where you need a real anxiety specialist to help you. And yeah, so then why doesn't talk therapy work for those? Well, I mean, I could just explain it just in basis of the brain, really. If you look at how the brain is structured, I'm going to use Dan Siegel's hand model of the brain. Is what this is. So this were a human brain right here, and these are all of the, this is the front brow bone right here, and this is the brain stem at the base, the back of the neck here, and then the spinal cord going all the way down to down here would be the legs and so forth, and off of the spinal cord would be all of these nerve bundles that would run into different organs, maybe into the heart and lungs, and then into the digestive system, and then into the lower diaphragm, and then further down into the intestines, and then into the groin and so forth, all along that central line. So if you look at the brain, the way the brain works is words come from the outside part of the brain, this outer layer of the brain. That's called the neocortex. It's responsible, that part of the brain is really responsible for our problem-solving skills, for our ability to prioritize what to do, for good decision-making. And I'm smiling because we know now that the frontal part of the cortex actually fully comes online at about 25 or 26 years old. So we know that the brain really isn't fully even formed until 25 or 26. And this is why you've got maybe, some of the 19-year-olds or 22-year-olds or 24-year-olds, and nothing to say bad about you if you're that age, but maybe the better decision-making parts haven't fully come online just yet. And there's a thing called myelination that happens from the back part of the brain all the way and then extends across the front, and that occurs over several years that happens until finally the final piece is this front part of the brain. So the reason why talk therapy doesn't work for anxiety, severe anxiety conditions, is because it's coming from a totally different part of the brain. Ask yourself if you have any of those, if you get panic attacks, or if you have obsessive thoughts and scary thoughts that are coming in, or lots of worries about this thing or that thing, or maybe worried about getting sick, or that you have an illness, or maybe socially get in social situations and you're freaking out. So ask yourself why your brain can't think straight in those situations. Can't think straight. And you can't talk yourself out of the fear. Anybody ever tried to talk themselves out of the fear? Oh my gosh, okay, I gotta calm down, I gotta get it together, I gotta ground myself. All of those don't work because the verbal part of the brain is in a totally another part of the brain. It's in a different part. This outside cortex is where the verbal parts of your brain are. Broca's and Wernicke's area in the brain, that's in the outer portions of the brain. The inner portions of the brain, when we peel that off and look on the inner portions, this lower kind of pyramid-shaped part of the brain and the bottom back part of the brain, it's shaped like a cone maybe, or an upside-down pyramid. That part of the brain, from basically this line, from everything below the level of the cortex below, that's all sub-awareness, or what's called the limbic system. And the limbic system isn't affected by talking, very little by talking, in fact. There are certain ways to use the upper cortex or to use your words, maybe to self-talk, and there are certain keys to that, one of which I can just give to you. I mean, you want to make your self-talk very short, not long, reasoned paragraphs. Lower brain doesn't understand short, reasoned paragraphs. Maybe doing maybe some slow, deep breathing with the short phrase, I'm okay. And I'm okay. I'm okay. I'm okay. So can you see how that's a very short? Now, words like that may work to help a little bit. They won't totally take the anxiety away, but indeed they'll. So this is why out in the world, I would say at least 95% of the therapists and clinicians and psychologists out there are not equipped to work with heavy-duty anxiety, because here's what they'll do. They will give you, if you go to a therapist that isn't certified to treat anxiety, that isn't good at exposure therapy, knows very little about exposure therapy, knows nothing how to do graded exposure or desensitization or progressive desensitization or interoceptive exposure or all the different forms of exposure, if they don't know how to do that, then what they're going to be doing for you in your session is listening to you talk and asking you a couple of questions. That doesn't take away an anxiety disorder. That if you think about it, you might have already been trying that yourself to talk yourself out of your anxiety issue. And it just doesn't work. Again, they're in two separate parts of the brain, Now, what are you going to look for in therapy? What kind of therapy? If talk therapy doesn't work, right? So talk therapy, sitting on, doing old psychoanalysis where we lay on a couch and we talk about all of our neuroses and all of our dreams and do free word association. That isn't going to pierce through to take care of, say, OCD or chronic anxiety and GAD, generalized anxiety disorder, or chronic condition with being afraid of getting ill or constantly being afraid of cancer or brain tumors or heart attacks happening. If those won't work, well, then how do you get to it? How do you make it better? Well, there's a way to make it better. And it turns out we have a lot of knowledge to be able to do that. We have a lot of ability to be able to pierce through and to communicate with this lower part of the brain that generates the anxiety. Right? There's a lot of really cool techniques and methods to do that, and actually to rewire the brain, to rewire its neurology so that it's not feeling so terrified in different situations and with different sensations or different thoughts. So in the specialized type of therapy, it's going to be some type of therapy that will involve cognitive behavioral therapy, but just not that. More specifically, a portion of cognitive behavioral therapy is called exposure therapy. And so that is how you work with anxiety conditions and get them to get better, is through exposure therapies, actually exposing the brain and exposing this nonverbal part of the brain, this amygdala, exposing it gradually to the situations and sensations and thoughts and so forth that it fears in a very slow, methodical way. And then alongside of that, having a lot of support alongside of that so that you're very well supported, you feel very well resourced, and you feel very comfortable and safe doing it. That's what a good anxiety therapist is going to do to get you from totally panicked and freaking out or brain locking up on a bunch of thoughts and obsessions to all the way over to here to feeling much better, having normal life, being able to re-engage back in life and so forth. So talk therapy doesn't work for anxiety conditions. Talk therapy doesn't work for real anxiety conditions. Can help a little bit, and certainly a good exposure therapist is going to have those talk abilities too. They're going to be able to help you talk through stressors and help you to they'll help you to reflect, they'll hold space for you, but then they're going to take you way further than that. One of the biggest things that people always say to me is, man, I worked with this other therapist. They didn't tell me anything about this. They didn't tell me how the brain works. They didn't tell me why my brain was doing this. They didn't give me anything to do. They would just kind of nod and say, how do you feel about that? So there you go. And it's not to say that such a talk therapist or even a generalist doesn't have their place. No, they have their place, and there's a lot of excellent, I know them, several excellent general therapists and talk therapists that really do really well and can really help in certain situations, but not with anxiety disorder, not with anxiety disorders in the grand scale of anxiety disorders. So another type of therapist that you want to avoid is what I call a generalist. And not that generalists are bad, but if you think about it, if I were going to fix something in my home, let's say that I had a problem with the electrical system, I don't go to my plumber and say, hey, you just did a great job on my plumbing and you just unclogged my toilet and you kind of put new valves in there and everything. Hey, can you take a look at these lights over here too? I don't do that. Why? Because there are specialties within a house. You've got a roofer you want to contact for roofing problems. You've got a plumber for plumbing problems. You've got an electrician. You've got HVAC and so forth. So you have all of these. You have tile people and counter people, and there's so many different parts that come together. And the human mind is even more so like that. So for anyone to say, well, yes, I work with depression and I work with PTSD and I work with anxiety and I work with borderline personality disorder and I also really, really work good with eating disorders and I work good with any kind of bipolar disorder and I work really, really well with are you following me? It's just impossible. What you're going to get is a hodgepodge of techniques and usually people that aren't really, really good at what they do. What you want to look for is somebody who specializes in anxiety disorders, that they live, eat, and breathe it. They research it all the time. They are constantly up to date on how to, on the latest techniques, and they're constantly training. They're constantly broadening their ability base through, in what really works for anxiety issues. So you don't want to go to the electrician if you're having a plumbing problem and vice versa. You want to find the plumber. You want to find the electrician if you've got electrical problems. You want to find the roofer if you've got a roofing problem. So for that reason too. So we're going to avoid both talk therapists. We're going to avoid them. Those are not going to give you the kind of, they're not going to give you the solution and take you to the solution and to the healing you're looking for if you have an anxiety disorder. And we're not going to go to a generalist either. We're not going to go to somebody who does a little bit of this, a little bit of that, a little bit of this. Doesn't work like that. And you will slow down your progress and you will inevitably, have a harder time there and not get to the healing that you want fast. So there you go. Hopefully that helps.